when I try to look at this and figure out what to do, this becomes a difficult problem because there's so many things to think about when you're looking at revision surgery. So in an effort to sort of, organize this, I just sort of came up with the ABCs, the most common problems, because I think any decisions you make regarding revision surgery and arthroplasty really has to be done in deference to the most common differentials of the problems that can happen. So I like simple mnemonic things. You saw that. So this is what I came up with here: A, B, C, D, and E. So A is aseptic loosening, by far the most common thing that we see. B is bony impingement, either anteriorly and or gutters, oftentimes from overgrowth or subsidence of the talar component. C is cyst formation, both in the tibia and the talus. D, disasters like infection, polyfracture, dislocation, et cetera. And then E is extra joints or adjacent joints. So the general framework here, when you're looking at this, all starts with the history. Why did they have an arthroplasty? How long has it been? Did they have any wound care issues, progressive symptoms? Were they asymptomatic or were they never good? Do they have startup pain? Is this a static problem, a dynamic problem? And do they have mechanical symptoms or more neurologic in reason? In general, I start with the location. That's the most important thing. That'll help you differentiate gutter pain versus instability versus stiffness, adhesion, scarring, and nerve dysfunction. And of course, everybody gets imaging, all the standard AP lateral oblique, hindfoot, dorsiflexion, plantar flexion views. And then moving on to other things like SPECT scans and CT scans on an individual basis, which we'll talk about next. It also helps evaluate adjacent joint disease with differential injection. I find this very helpful. You can just not even put cortisone in it, just a cc or two of local into the medial gutter or the lateral or the sinus tarsi, depending on if you think it's subtalar joint pain or TN. Remember that talonavicular joint pain often mimics ankle pain, and it's very difficult for the patient to tell the difference. So sometimes a TN and joint injection will help you move towards a TN fusion as opposed to a revision arthroplasty or an impingement procedure.